This is Sandy Tankis, and I'm here in Port Washington with the Long Island Alzheimer's Foundation, or at the Long Island Alzheimer's Foundation. And I'm speaking today to Anthony Lombardi, who works here. Hi, Anthony.
Good morning.
Good morning. Anthony, what is your position here?
I am the day program coordinator.
And what does that mean?
That entails we run a social model day program here that specializes in moderate and late stage Alzheimer's/dementia.
And do you have a staff?
Yes, they are 2 certified dementia care professionals.
And the staff works with the patients, obviously.
Correct.
And what are the typical activities that separate you from other programs at the center?
We are very hands-on. We use computer activities. We try and incorporate new modern technology into the program, such as taking them around the world without even leaving the room. We even do ethnic cultural activities, such as trying to incorporate their ethnic backgrounds, finding their anthems, finding even their hometown, and showing them through the computer. We also incorporate sing-alongs, live entertainment, art therapy, which we gather around in a nice circle and paint to nice meditating music.
Oh, and that must have a bonding effect as
It
well.
does, greatly does, yeah.
Right.
And it also sparks conversation, which is very vital to the program.
Well, thank you so much, Anthony.
Thank you.
And this is Sandy again, and I'm still at the Long Island Alzheimer's Foundation. And I'm talking now to Tori Cohn, who also works here. And Tori, what is your position here?
I'm the director of our in-home respite program, and I also facilitate for caregiver support groups, which are spousal and adult children.
And I understand that LIAF, which is Long Island Alzheimer's Foundation, offers different support groups for family caregivers. So why would somebody want to share their private feelings with a stranger, just a complete stranger, rather than just talking with their own family, their own relatives, their own friends?
Well, we provide, or I should say, I'm providing that safe, nurturing environment where they can vent their feelings of frustration, rage, anger, sadness, or even grief with a group of people that are all in this disease together and are dealing with these similar issues at home, and they can relate on a level that instead of talking to their families or coworkers, which it might just be too hard and too difficult to hear, that they feel comfortable talking to a stranger because they all are dealing with this disease together.
And I see that you offer respite services, so why is that important?
Well, our respite program is our only program that is not in the foundation and out in the community. And this is a program that for people who aren't able to leave their house, that we have trained professionals go into the home and be able to provide cognitive stimulation to the person who is diagnosed with Alzheimer's or dementia and give the caregiver a much needed stress relief for them to be able to go out or be able to just relax in their home and take a nap, just be able to give them a much needed rest.
Okay, and that's very helpful to the family.
For the time that we've had the respite program, there's always been a waiting list. People, are always, wanting, more and more help. This is, definitely one of those cases where they feel very relieved when someone comes in and takes over for a while.
Thank you so much, Tori. Okay, and we're going to wrap up this afternoon, or this series, with LIAF, Long Island Alzheimer's Foundation. And I'm here now with the executive director of the organization, Fred Jenny. Good morning.
Good morning.
And why don't you tell us what makes LIAF unique?
Well, the Long Island Alzheimer's Foundation is one of the longest running nonprofit agencies on Long Island dedicated to direct services to Alzheimer's families, serving both the individual with Alzheimer's disease and their family. So from the very beginning, The organization was rooted in providing service to the entire family, to the diagnosed individual, and to the family members that are providing that care and support. What we have here is that we do pre-diagnosed individuals through doing memory screenings. We have a brain fitness program for people that don't have a diagnosis but are concerned about being proactive and taking care of their cognitive abilities.
Now, I know that there's issues of transportation and getting places. Seniors often have a problem because they no longer drive, and sometimes they have aides who don't drive. How do people get to your senior center here for help with their disease?
Well, we're very fortunate to have a 16-passenger vehicle that can transport people to and from our programs here. It is handicapped accessible, and I'd say one of the key elements is that our drivers are trained to work specifically with folks with Alzheimer's disease and are very cognizant of their special needs. Folks also can utilize Project Independence as another way of accessing our services.
That's Project Independence if they live in the town of North Hempstead. But
That's
if they
correct.
don't live in the town of North Hempstead, it's not available to them.
That is correct.
So if somebody is sitting home at this point and they want help and they're in the New York area, I could see that they would contact you because you seem to have a great program here. What if somebody is looking at this video who lives in Nevada or California or other parts of the country that might be watching?
Well, I would suggest that one of the places that they could start is that each county has an area office on aging, and they could call information and get the phone number of their local county office on aging, and each state also has an office on aging. So there'd be the availability of a lot of information specific to Alzheimer's disease and or aging and caregiving. They also can reach out to the Alzheimer's Foundation of America, which is located in New York City.
Thank you so much for explaining things further and for summing up for us.
Thank you.